Welcome to the bariatric gastric bypass and sleeve discharge video. You will notice that your incisions will be sore for several days after surgery. During the first several months, you will lose weight quickly. As time goes on, your weight loss will slow down. This surgery is a tool to help you lose weight, not a fix, so it is important that you follow a healthy diet and exercise plan. You will experience different emotions after surgery. This is normal. Talk to your surgical team about any anxieties that you may have. It is important that you stay active after surgery. Rest when you feel tired and get enough sleep. This will help you recover. It is important that you walk for several times during the day. This will increase blood flow and help to prevent pneumonia, blood clots, and constipation. At your follow-up appointment, ask your surgical team when it is okay to go back to work and to start an exercise program. Avoid lifting anything over 10 pounds or anything that will cause you to strain until your follow-up appointment. This includes lifting a child, running a vacuum, lifting heavy groceries, dog food, or cat litter. To support your abdomen and to help decrease pain, place a pillow over your abdomen when you cough, sneeze, or take deep breaths. Continue to do your coughing and deep breathing exercises when you are home to help prevent pneumonia. Use your incentive spirometer 10 times every 2 hours when you are awake. If you have sleep apnea, it is important that you use your CPAP or BiPAP machine when you are sleeping, including naps during the day. You may shower. Pat your incisions dry. Do not take baths, swim, or use hot tubs until your follow-up appointment. Ask your surgical team when it is okay to resume driving and sexual activities. Do not drive while taking narcotic pain medications. It is important that you drink at least 64 ounces of fluid during the day. Sip liquids throughout the day to prevent dehydration. Be sure to follow your written diet instructions that you will receive upon discharge. You will go home on a clear liquid diet. Remember, no carbonated beverages, sugar, caffeine, or drinking through a straw. The clear liquid diet includes water, G2 Gatorade, clear vegetable, chicken, or beef broth, and sugar-free popsicles and Jell-O. You can also drink apple, grape, or cranberry juice. These juices must be diluted. Fill a container with half the amount of juice and the other half with water. You may notice that your bowel movements are not regular right after surgery. This is common. Sometimes the stomach empties too quickly into the intestines. This is called dumping syndrome. It can cause diarrhea and make you feel faint, weak, shaky, and nauseated. Avoid high sugar foods such as desserts and undiluted fruit juices, as these can cause dumping syndrome. Do not drink 30 minutes before or after eating meals. Chew each bite 20 times. Allow 20 to 30 minutes for each meal. Eat 5 to 6 meals or snacks during the day. And remember, drink at least 64 ounces of fluid during the day. If you become nauseated, wait 30 minutes and then start drinking liquid slowly. Drink small sips at first, or suck on ice or a popsicle. Drink often to prevent dehydration. For some people, room temperature liquids are less nauseating. Signs of dehydration include dark colored urine, dry mouth or skin, nausea, headache, dizziness, and thirst. Call your surgeon's office if you have any signs of dehydration. Take all medications as prescribed. You may notice that some of your home medications have been stopped or the dose changed. Follow up with your primary care doctor if you have any questions about your home medications. Take all prescribed pain medication exactly as prescribed. You may feel chest, shoulder, or abdominal discomfort caused by gas. A heating pad or using the knee chest position can help decrease this discomfort. If you feel like your medications are causing you to feel nauseated, try taking your medications after meals unless it says to take on an empty stomach. Your written discharge instructions will let you know when it is okay to take your vitamins. It is important to take your vitamins as prescribed in order to prevent vitamin and mineral deficiencies. If you have a clear plastic covering over your steri strips or Band-Aids, you may remove the clear dressing or Band-Aids 3 days after surgery. Do not take off the steri strips. They will curl and fall off on their own. If your incisions were covered with skin glue, you may wash your incisions gently with warm soapy water. Pat the incisions dry and leave open to air. Be sure to keep all follow-up appointments. If your follow-up appointment was not scheduled before your surgery, call the surgeon's office to schedule an appointment in 1 to 2 weeks. At discharge, you will receive a discharge journal to keep track of your daily care and fluid intake. Bring your discharge journal with you to your follow-up appointment. Call 911 anytime if you feel like you need emergency care, such as sudden chest pain, shortness of breath, or passing out. Call your surgeon's office for any of the following. Your pain does not get better after taking pain medications. You cannot pass stool, gas, or have severe abdominal pain. You feel sick to your stomach and cannot drink fluids. You feel like you are dehydrated, or you have signs of a blood clot, such as increased redness, swelling, pain in your calf, back of the knee, thigh, or groin. Call your surgeon's office if you have any signs of an infection, such as increased redness, swelling, or drainage to your incisions, pussy or foul-smelling drainage, or a fever of 100.5 degrees Fahrenheit or higher. Please ask your nurse if you have any questions or concern regarding your discharge to home. Thank you for choosing UPMC Magee Women's Hospital for your care.